Look at that.
Oh. Hey!
He doesn't.
Alright. My name is Taryn Buechler, and I'm presenting my informative speech. Childhood obesity has been an increasingly serious problem globally over the past 30 years, but has recently been found to be significantly more prevalent in America than in most other places. While the topic of obesity and being overweight may be an easy topic to brush aside, it actually has the potential to lead to numerous life-threatening health issues as well as social and psychological consequences. As a result, childhood obesity is regarded as the most common and prevalent nutritional disorder of U.S. children and adolescents and is one of the most common problems seen by pediatricians. Unfortunately, despite years of attempts to implement new prevention programs and to reduce the obesity epidemic in America, little improvement is to show for all the hard work that has gone into it. According to the Centers for Disease Control and Prevention, over 1/3 of U.S. teens and children are overweight or obese. Obesity hasn't only doubled in children, but has also quadrupled in adolescents just over the past 30 years. Hopefully, when hearing this statistic, it puts just how serious this issue is in perspective for people. Pediatricians have found that risk factors for childhood obesity can potentially begin before the child is even born. Pregnant women are urged to be more aware of numerous of these factors before becoming pregnant, such as if the mother is obese or overweight, along with if the mother has a history of smoking. A newborn who is not breastfed, doesn't get an adequate amount of sleep, and gains weight abnormally fast has an increased risk for obesity later in life. Making sure parents and children are educated about the risk for childhood obesity and are aware of healthy eating habits is crucial, but lecturing alone isn't enough. Instead, parents should be better informed on where these nutritious foods can be found and where at a reasonable price. Physicians should also inform and encourage families to buy fewer foods that are linked to obesity, such as artificially flavored juices and high-calorie snacks or desserts. One of the most frequent and widespread consequences following childhood obesity is the psychological effects it has on adolescents. Early on, these adolescents become targets of discrimination and continuous bullying and self-esteem issues. This psychological aspect is relevant in the vast majority of obesity cases, with the ongoing concern about weight expressed at a very young age. This concern about an idealized image that the media hammers into young women's heads in today's society is prevalent everywhere, but is especially prevalent in young female athletes who face these high expectations to be thinner every day. Anxiety and depression are two very real consequences of childhood obesity and have the potential to lead to serious psychological deterioration and complications. According to psychological issues in pediatric obesity, there are also subtle but notable cognitive impairments in overweight children and adolescents. These children have been found to score lower than normal control cases on various performance tests and also generate IQ scores 3 to 10 points lower than the normal population for their age. Certain neuroimaging studies in pediatric obesity have also demonstrated white matter lesions in these children at an early age, which mimic certain findings seen in Alzheimer's and vascular dementia. Depression in these individuals is often associated with guilt pertaining to overconsumption of food and excessive weight gain. Fatigue, sluggishness, and lack of motivation are often signs of depression in these children. While physical health issues are thought to be more detrimental, the psychological factors can be just as draining and negative on these children. The social aspect of childhood obesity is also very damaging to adolescents. Children often bully and belittle their overweight peers, which inevitably leads to depression and low self-esteem issues. According to health consequences of obesity in youth, there has been a significant increase in behavioral and learning difficulties among children who are overweight or obese, as overweight children tend to have poorer social skills and interactions with classmates and adults than their thinner peers. This leads to a decrease in motivation to do well academically, as well as impulsive behavior and the child acting out in classroom settings. Some possible explanations may be sleep apnea or additional psychological problems within families. One study that was demonstrated showed that among girls specifically, acceptance rates were lower among those who were overweight than among their average weight peers with comparable interests and credentials. The social stigma of obesity and being overweight can be just as damaging to children and adolescents as the physical conditions it induces, in its own way, of course. Studies have shown that children as young as 6 years old who are more overweight than peers may be associated with a negative stereotype and genuinely believe that they are less likable simply because of the extra weight. Obviously, there are exceptions, but in general, if a child or adolescent is overweight, they will likely have a loss of self-esteem, which can lead to a lack of confidence and essentially poor academic results in school and social settings. Overweight children and adolescents are not only more prone to serious consequences pertaining to psychological and social aspects, but are also significantly more at risk to life-threatening health issues. Childhood obesity, or obesity in general, can have an extremely harmful effect on the body in numerous ways. According to research conducted from the Bariatric and Metabolic Institute, obese children are more likely to have high blood pressure and cholesterol, which are risk factors for cardiovascular disease. In one study, 70% of obese children had at least one cardiovascular disease risk factor, while 39% had two or more. They are also at an increased risk for impaired glucose tolerance, insulin resistance, and type 2 diabetes. Breathing problems such as sleep apnea and asthma, joint problems and musculoskeletal discomfort, fatty liver disease, gallstones, and gastroesophageal reflux or heartburn. Type 2 diabetes is one of the most common conditions seen in obese children and patients, as that excess weight and more lackadaisical lifestyle increases the risk of this type of diabetes. Obesity and a poor non-nutritional diet significantly play into the high blood pressure and cholesterol. These contribute to the buildup of plaque in arteries, which can lead then to a heart attack or stroke later in life. As mentioned prior, sleep apnea is one of the main sleep disorders seen in obese children and can actually be life-threatening, in which a child's breathing intermittently stops and starts back up while sleeping. Hyperlipidemia is another condition associated with obesity where there's an increased blood lipid count common in these children and adults. This is treatable but can be a lifelong condition. These various health issues have a direct relationship with obesity. As weight increases, so do the risks for these conditions and disorders. There are numerous factors that contribute to childhood obesity. Poor food choices and lack of physical activity prove to be the most common, but other factors that may be more overlooked play into childhood obesity as well, one of them being the parenting style. Some researchers believe that an excess of parental control over a child's eating habits can actually have a negative effect on the child's health and may lead to poor regulation of the child's energy intake. Further, parents with poor eating habits and physical exercise regimens set bad examples for their children who are already at risk, and an increase in overweight children is commonly seen in these types of family settings. Surprisingly, whether or not a mother breastfeeds is also a crucial factor in childhood obesity. Breastfeeding is generally recommended over formula feeding for many reasons, one of them being that it reduces the likelihood of that child becoming obese in years to come. Demographic factors, diabetes during pregnancy, and low birth weight are also important factors that play into childhood obesity. With childhood obesity now regarded as the most common and prevalent nutritional disorder of U.S. children and adolescents, and one of the most common problems seen today by pediatricians, there is an increased need for preventative programs and lifestyle changes now more than ever. These numbers are going to continue to spike if more intense implements are not sought after and executed. With the abundant amount of health concerns as well as destructive psychological and social detriments, this epidemic is not simply going to disappear without major enforcements being put into action. These numerous statistics that are not included as a scare tactic, rather to inform listeners that childhood obesity is not simply concerned with appearance, but is a very grave issue in this nation that can no longer be overlooked as it has steadily increased over the past 30 years and will continue to increase in the absence of serious implements.